for me? Looking at the teeth, the gums, the cheeks, looking for lesions, sores. Okay, if you'll stick your tongue out for me, all the way out, that's testing for cranial nerve 12. And the uvula is rising midline when you say ah.
Ah.
Looks great. The tonsils are present and 1 plus. And one more time, I'm going to gag you. Sorry. Sorry. Okay. And the gag reflex is intact. So 9 and 10 intact. Okay, if you can stick your tongue straight out for me and move it side to side. Okay, and lift it. Very good. We're going to move to the posterior chest now. Posterior thorax. First, I've already inspected and there were no lesions. Now I'm going to just palpate for any tenderness, any nodules, masses. Is anything here tender?
Nope.
Okay. And palpating the spinous processes. Okay. I'm going to palpate for fremitus. If you will just say 99.
99. 99. 99. 99.
And for respiratory expansion, if you could just take a deep breath. Good. Excellent. Okay. I'm going to percuss the posterior chest now for consolidation. This should be resonant over this entire area. When I get down below the diaphragm, there would be dullness. Is there any costovertebral angle tenderness when I tap your back?
No.
On this side, none?
No, ma'am.
Okay. And on this side?
None there either.
Good. We're going to auscultate your lungs. With the diaphragm. Take a big deep breath for me. You okay?
Mm-hmm.
Again. Okay, great. I'm going to go ahead and check your sorry, I'm spinning you around again. I'm going to check the range of motion in your upper extremities. If I could get you just to, while I'm palpating these joints, if you could just rotate your shoulders around. Good. Got a little crepitus in this one. Okay. And this one? Not so much in that one. Okay. Just a little bit here, but more on this side. Okay, if you could ball your fist up for me, and I need you to try to pull up against resistance, okay? And push down, okay? And then put your arms up like this, pull back, and push forward. Good, okay. All right, I want to feel your brachial and your radial pulses. I'm feeling for the strength and regularity of that. Okay, and then this side. All pulses are strong and equal with a regular rhythm. Okay. But if you could take your watch off for me. Thank you. Put it over here. I'm going to do a couple of tests for carpal tunnel syndrome. The first one is Tinel's, and that's where I'm going to tap on the medial nerve. Do you have any aching or numbness when I do that?
Nope.
No? And on this side?
Nope.
Nope. Okay. All right. Now, the next test, I'm going to need you, and this seems like forever to hold this for 60 seconds, but I'm going to need you to push the backs of your hands together. This is Benel's, and this is for 60 seconds to test for carpal tunnel. In 60 seconds, if you have numbness, then that's a positive sign for carpal tunnel syndrome.
Okay.
Seems long, doesn't it? Almost there. Okay. Anything? Any
No.
numbness? Okay. I'm going to check your reflexes in your arm, your brachial. About 2+ there. And 2+ there. Your tricep. I'll have you just rest your arm on my arm.
Okay.
Just let it fall. Okay,
Yep.
2+ there. And again. Okay, 2+ there. And your radial. Here we go. Let's try this one again. Yeah, okay, 1+ there. Okay, I'm going to go ahead and do deep tendon reflexes in the patellar area also while I have you sitting here. Good. And the Achilles. Good 2+ there. Let you relax that leg. Okay. And I'm going to do the plantar reflex. Okay. You have a negative Babinski. You did just what you were supposed to do. Those toes curl up instead of fan out. Just a test for sensation to see if you have the sharp. You feel sharp there?
I do. Sharp.
Feel sharp there?
Yes. Sharp. Sharp.
Okay. All right. And also I need to check strength and range of motion of the legs. Bend your knees. Here we go. And pull your legs back toward you. Good. And push them toward me. Good. All right. And push your feet down. Good. And push up. Good. Okay. And toes down. And toes up. Okay. I'm going to go ahead and put you listen to your lungs in the front before I have you lie back. And then I'll do your cardiac assessment with you lying down.
Okay.
Deep breath. I'm gonna have you go ahead and lie back. Move the bed at about 30 degrees and just relax your extremities down. Just looking at the jugular veins for any jugular vein distension. Looking at the carotids for pulsation. And the aorta for pulsation. We've already inspected the skin of the chest. I'm going to percuss the chest now, or palpate the chest now. The precordium. For any thrills or heaves. Okay. And now percuss the chest. Noting resonance on both sides. And dullness as we get over the liver. Go ahead and listen to your heart. I'm going to start with the bell, listening at the second intercostal space for the aorta, to the right of the sternum for the aorta. And then at the second intercostal space to the left for the pulmonic. And then at the third intercostal space at Erb's point, the second pulmonic. Then down at the third and fourth for the tricuspid. I'm listening for any murmurs. And then at the mitral, the point of maximum impulse would be the fifth intercostal space, mid-clavicular. While we're working with the bell of the stethoscope, I'm going to walk around and have you turn up on your left side just so that I can listen for any mitral regurg. Listening at the point of maximum impulse for any murmurs. I do not hear any murmurs. All right, and then if you'll roll back for me again on your back. Then coming back with the diaphragm in the same order at the second intercostal space. That was aortic. Now pulmonic. Back at Erb's point with the diaphragm. Listening for S1 and S2 in these areas. I don't hear any splitting of S2. Coming down the tricuspid. And at the fifth intercostal space midclavicular. The rate is regular, and I cannot discern any murmurs at any of these points. Now, while I'm on this side, I'm going to go ahead and palpate the abdomen. First I want to listen for vowel sounds in the abdomen. And we do that, of course, because if I go palpating it, then I'll kick vowel sounds up more.
Okay.